Dear students, welcome to GAME, Gross and Microscopy Explained. I hope you are able to identify the diagnosis. It is straight. It is polycystic kidney. It can be given to us as a specimen for description, chart, kept in the viva for questions, and it is definitely a frequently asked theory question. As I always tell you people, kindly interlink game and R.A.T.S. Please go to R.A.T.S for the theory part of it. I would like you people to kindly describe. You should be very lucid in your description. What is the specimen, what you are seeing, external surface, so on and so forth. And always compare. There is a lesion on the right and a normal counterpart on the left. So what are these two? It is a normal kidney in which I am able to find the corticomedullary differentiation and also the renal pelvis, the calyces. So it is normal and down is the ureter. But in this case, I am finding multiple bubbles of varying sizes involving the entire kidney. And also externally it seems to be bulging so that I will be able to appreciate it from outside also. So this is one type of a polycystic kidney. Now what are the main causes for this cystic lesions? Your Robbins gives three mechanisms. One is obstruction. Because of the obstruction, there is a ballooning and then there is a cystic space. Compliance or weakness of the basement membrane. Therefore, again, it gives way. And third one, epithelial hyperplasia, and when they sit on the basement membrane balloons out. So these are the three fundamental mechanisms. I have explained it in detail, including the genetic background of it. Please go and see the facts. There are two cystic lesions on the screen. In one, I am finding multiple well-circumscribed lesions of varying sizes. Some are small, some are medium size, some are large. And as I told you, the external surface is getting bosselated. So it is, why do I say polycystic? Multiple cystic spaces are there. Fine. In this also, there are some cystic spaces, but then they are all radially arranged, as though it is a kind of a sunrise that I'm seeing. And externally, there is no bulging of the kidney, though the kidney itself can be slightly enlarged. In this case, it can be massive. So one is an adult type, another is an infantile type of polycystic kidney. And what are the differences? Here there is a disorderly arrangement. Here it is fairly orderly. Cortex is involved. Here a thin rim of cortex is usually uninvolved. External surface shows cystic nodules. Here it is smooth. And there is a varied lining in this because all the ducts, the collecting duct, the descending, etc. will be involved. Therefore, different types of epithelial lining will be there. Here it is uniform. Autosomal dominant occurs in adults, recessive in children. So these are the differences. Again, I say go back to R.A.T.S, go back to your text. This kind of a specimen can be kept for you. In fact, our specimen is more bland because it has been kept in formalin for a long time. It is a mounted specimen of the kidney measuring dash into dash into dash centimeters. You are supposed to measure and then write. It is reniform or bean shaped in outline. That is why I am saying that it is a kidney. The external surface is gray-white, smooth, but it is bosselated because I am finding multiple bulging areas that are there. It can be glistening and it is partly covered by fat and fascia. The cut surface shows multiple cystic lesions as we had seen or will be seeing in this. So this is the cut surface of the kidney I find that cyst means each one of these. Look at this minute cyst as well as the larger one. They are all walled by a smooth inner wall. Some are intact, transparent and translucent. So I find that some of them have not been cut through. They are transparent because they contain the straw colored urine. And after all, what is a cyst? It is a dilatation of your tubules. And what do the tubules contain? Urine. This is a usually asked question for undergraduates. Even otherwise, you should confidently answer. And separating the cystic spaces is the parenchyma or the interstitial tissue. The interstitial means the intervening supporting tissue. And there is no corticomedullary differentiation. Everything is lost. You'll have to mention the size of the largest cyst, size of the smallest cyst, and the contents. Beautiful one. I would like you people to again practice. What I would like very much is the reniform shape of it. Kidneys can be bean shaped, beans can be kidney shaped, etc. Multiple cystic spaces going up to the cortex and bulging into the exterior. And they have got a smooth lining over here. And the interstitium is kind of atrophic. These are the structures that I see. I find the ureter, the vein, and the artery. A beautiful diagram. Reniform in shape, cystic lesions, smooth inner wall, hardly any interstitium, no corticomedullary differentiation, no renal pyramids, ureter, vein, and artery could be made out. And I would like you people to kindly find out any number of differences. 6 is just a start. So you people can compare and make the differences. I would like to see you people in game 55.